World Cancer Day is marked on February 4 each year, and today we are at the Barbados Cancer Society with Acting President Professor David Rosin to get an idea of cancer in Barbados.
Could I start by saying how important World Cancer Day is? Throughout the world, we celebrate, that's probably the wrong word, but we talk about cancer on a specific day to make people much more aware of this disease and what can be done and how to prevent it. So it's an important day and very important for us in Barbados as well as the rest of the world. When we talk about cancer, I'd just like to give you a little bit of history about it, because cancer has been around a long time. Hippocrates 2,000 years ago wrote about cancer of the breast. So we know it's been around, but in fact, if we were doing an interview, let's say 100 years ago, 120 years ago, we wouldn't really be talking about cancer. We'd be talking about the scourge at the time, which was tuberculosis. Nobody mentioned cancer. And it's interesting that when I was a student 40 years ago, we didn't mention the word cancer. It was a dirty word. You didn't talk about it. You talked about tumors or growth. So it's really recently that we've become much more aware of cancer. And there are lots of reasons for that. Not just that people are able to talk about it more often, but it seemed to be becoming more prominent. But it isn't actually. Most cancers haven't really increased that amount. What's happened is that we now have the ability to diagnose them, which they didn't in the past. So we're diagnosing cancer, so therefore people are much more aware of it. And of course, and we'll get onto this a little bit later, we're screening for cancer. And especially people who have families within the family there's been cancer. So cancer in Barbados, it's an important topic. We have a population of over 280,000 people, and there's something like 1,200 cancer cases, new cancer cases each year. Of that, not of the ones that are necessarily new, but cancer cases in Barbados, over 700 people every year die from this disease. Now I say this disease, but we have to remember, cancer is not one disease. Cancer of the breast is very different to cancer of the lung, which is very different to skin cancer. The combining thing, what makes them all cancers, is they're really normal cells which are dividing, as all our cells do all the time, but dividing out of control. And one day, I'm sure when we're getting there, find a way to stop that division when they're out of control, turn the key off. So yes, there are a few cancers which have increased, especially say skin cancer, but then there are cancers across the world which have decreased, like lung cancer. And when we look at the epidemiology, how they develop, etc., we have to think, why is this happening? Why is it happening? Skin cancer is getting more common in light-skinned people because the ozone layer is disappearing. And therefore the injurious rays coming through from the sun are that much more damaging to the skin. Why is lung cancer much less than it used to be? Well, people have stopped smoking, thank goodness. As soon as we found out there was a link between tobacco and lung cancer, people stopped. It's still number one cause of cancer in the world today. And that's because the biggest population of the world, India and China, with 1.4 billion people each, are still smoking a lot. But here in Barbados, for instance, lung cancer is about fifth on the list in the hit parade of cancers. So yeah, it's really important. If we look at a sort of 5-year survey, we would talk about 3,000 people with cancer at any one time in this country.
Okay, you just spoke about a list of cancer. What is the ranking, the number one?
Right. The cancer that is most prominent here in Barbados is prostate cancer. Now, that's fascinating when you think that it's only half the population, because we're roughly half and half of male and female. So that means that that's really quite a prevalent disease. Something like 320 cases in 2018, when there was the last census. And the other problem with prostate cancer is that it is the biggest cause of cancer death on the island. Again, in 2018, there were something like 111 deaths in a year. in that year. So prostate cancer is number one. Colorectal cancer, cancer of the colon, the large intestine, is number two. Approximately, one would say, 124 people a year, 24%, and then breast cancer. But if we look at men, it's 50% of all cancers in men are prostate, and if we look at women, of course, it's about 45% of breast cancer. And then the other cancers, such as lung and the pancreas, stomach, they occur, but they're really in quite small numbers here in Barbados, fortunately. We're talking about 4% of cancers for lung.
What is the picture of cancer among the younger population?
It's very small, actually. I can't give you the figures, and I don't have the figures for pediatric children's cancers. It seems to be the rarer cancers, and we see people with bone cancers in children, which don't affect the adult population as much. When they occur, they are, of course, that much more distressful, because you see a child, and most of those types of cancers, there's a kidney cancer which occurs in children under the age of 4. And it's really quite distressful when you think that their life may be cut very short from this cancer. But I would say in Barbados we're very fortunate that pediatric children's cancers are not prevalent, and they hit the headlines because they're rare and because they seem to be a bit aggressive. If we turn to sex difference in cancers, prostate cancer is a very interesting cancer here in Barbados, for the simple reason that men of African descent, whether Afro-American or Afro-Caribbean, they get cancer of the prostate at a much younger age. Usually cancers in the Western world, in Europe and America, occur over the age of 60, maybe 55, but 60 plus. And it's not an aggressive disease. Few people, men, die from cancer of the prostate, provided it's not left and if it's caught early. Whereas here in Barbados, it's occurring in men 50 plus. In our large trial that we've just completed, we tested some controls between 40 and 50, and none of those men had prostate cancer. But between 50 and 60, there were quite a number. And that's much younger than we would find in the rest of the world. One has to ask what the cause is. Well, it's genetic. There's no doubt about it. And the trial that we've just done, because we did a very large trial, I think it's the largest trial in men of African descent to date, on a very new specific DNA molecular signature, which you can find in the blood. And with the help of Yale University and Wren Laboratories in America, we've been testing. We tested 554 men. And of those men, 80 had a positive molecular signature. And we compared it to PSA, the prostatic specific antigen, which is a screening test which has been used since the 1980s. And it has a number of problems. There are false positives and there are false negatives. And the false positive means that there are other causes rather than prostate cancer that have caused it to be raised.
So when you say the false positive and the false negative, you're speaking of the PSA test?
We're comparing the PSA test to this new molecular signature. Now the difference between the two, they're both blood tests. But the PSA, as I said, there are a number of false positives. So people who just have a benign enlargement of the prostate, that can push the PSA up. If they have an infection in the prostate, prostatitis, that can push it up. And especially, not very high, but it can push it up, and it makes people anxious and makes urologists and people looking after prostate cancer anxious that they may be getting cancer. And therefore, a lot of biopsies are done, for instance, which are negative because they don't have the cancer. Equally, they could have a raised PSA and biopsies are done, but it misses the cancer because it's not necessarily in one spot of the prostate gland. And that would be a false positive. Now, with the molecular signature in the blood, because it's DNA based, it's actually predicting that this person, this man, will if he hasn't got it now, will get prostate cancer. And of the 554 men, 60, in fact there were 80 with positive molecular signatures, but 20 already we knew had cancer of the prostate. But 60 of them had no symptoms, no signs, and they had a negative PSA, but a positive molecular signature. Now these men are going to get prostate cancer. The other great advantage is that if you have prostate cancer, you can then monitor it. It also can show you the aggressive type. So PSA doesn't tell you anything more than you may have prostate cancer. This is going to tell you have prostate cancer, or you're going to get it, and it may be non-aggressive or aggressive, because the treatments will be very different.
So from this study, will you then continue to track the health of these 60 people to see at what point it starts to change?
Absolutely. We're now following them up every 3 months. And the laboratory who've done all this for free for us in America have agreed to test them again so they can monitor them. So from that point of view, we've been very fortunate. I mean, it's an expensive test. And the laboratory over there have paid for it. And we'll get on to fundraising in a moment, because we also had, before COVID, a fundraiser which has helped us run this trial.
So although you're saying, this test is saying that these people are predisposed to prostate cancer, as a medical professional, what can you do to maybe try to offset or delay what really seems to be inevitable? I don't think you can delay it. What we are really concentrating on is the earliest possible finding of that cancer. Because if, for instance, the PSA or the molecular signature goes up in 3 months' time, we can immediately do, the first thing I would suggest is done is an MRI to see if we can pick up. And it might just be a tiny spot. And if it's a tiny spot, that can be treated in a way without surgery or radiotherapy, just by ultrasound ablation, for instance. That's one way. So what we're planning to do is to make sure we get that cancer in the very earliest stage. Yes, we can't prevent it. Not yet, anyway. One of your slogans, early detection, prevention, we've been hearing that for the longest while. How is screening being received by the Barbadian population after all this time?
I think it's better, but it's by no means perfect. I always like to say to people, and those listening, when you don't wait for your car to break down. You go and have it serviced, and that'll fix it before it breaks down. Come and be screened when you get to a certain age, or if your family has a cancer in it, come and be screened before it happens. Because the earlier we diagnose this cancer, the better the treatment. And the much more likely you are to survive. The survival is very good nowadays. I mean, the surgery and radiotherapy, chemotherapy, immunotherapy, it's all now better and better than it has been. And therefore, find the cancer early, we're going to make sure you have a normal life.
So what do you say to the person who suspects that something is wrong, but they're so afraid they just don't want to find out?
Well, I hate to say this, but let me tell you that you women are much better than us men. For a start, I mean, the breast screening program we have here, the women come and have mammograms performed when they get to the age 40, whatever it is, and they get screened. But men, I don't know whether they're shy or embarrassed, but they don't come like women do. We're going to plan our next fundraiser, if we're allowed to do it with COVID, is a walk for prostate cancer. And I've said that, you know, the committee are talking about what men should get involved. And I said, get their wives, get their partners involved, because they'll bring them along. The men won't come. A lot of them won't come. I mean, I'm generalizing, but it is interesting. So you should be screened, I think, in this country, especially colorectal cancer. My next big trial is going to be on colorectal cancer, because that is the second most common in both sexes on the island. For men, prostate; for women, breast, but for both sexes, it's colon cancer. And again, if we come up with, they are now molecular signatures for 5 different cancers, and colorectal is another one, breast is another, lung is another, and specific renal cancers, cancer of the kidney. So if people want to be screened, wait for the next trial for colorectal. If you're over 40, if you've got anybody in your family with colon cancer, come and be screened as soon as we start that trial.
So do you put out a notice inviting members of the public to come and take part in these trials? How are people selected?
It's only done by word of mouth and by advertising, and they have to be willing participants, and we are dependent very much. Yeah, he should come along and have it done as well. We are dependent on them coming forward and joining these trials. It means that they get free screening during the trial, and it's a start. It's also, no doubt about it, it's getting around more that it's not a difficult thing to come and have a pinprick of blood taken, or a little bit of blood, and do some good to find out whether this is going to be very effective in the future.
COVID-19 has been dominating the headlines for close to 2 years, but based on the Union for International Cancer Control, we are seeing that it is really the 2nd leading cause of death in the world. What is the Cancer Society doing to keep cancer and education, in front of Barbadians so they don't lose track of it?
It's a very good question. And we try and educate outside the building as well as inside. We run lectures on different cancers. We talk to the general practitioners and the polyclinics, and we go out, if possible, to industry, and not only do we do testing for screening, but do education lectures as well at the same time. So I would like to see much more education in schools. I think the young, it's always better if you get the young. The young are more receptive. So I think we should. It's not going to affect them, but it's going to make them talk about it and be more open about it, which, as I say, is an important fact. And perhaps tell their parents, that they should be more aware. Lifestyle. I mean, we hear about in Barbados, there's so much sugar being drunk, and diabetes is almost a quarter of the population are diabetic. But there are things, lifestyles that are causing cancers as well. I've mentioned smoking and red meat already, but there are other things. Vitamin D is terribly important to protect against cancers. We're very fortunate. We have lots of vitamin D in the sun here, but in other countries they are actually giving vitamin D for that reason. Education is a vital part, and I'm very pleased you raised it, because we need to do more. We're doing our best, and we're not the only people who are doing it. I mean, the Cancer Support Society, there are mesothelioma, there are different groups who do specific talks, maybe on pediatric cancers, for instance, or things. So we're going to certainly enlarge on that and try and get out more, and I'm going to make a plea that we can get into the schools to talk about cancer, if we're allowed.
Thank you. And now let's turn our attention to fundraising.
That
remains a challenge for the Barbadians.
That is a real challenge, yes. I mean, it's been good up till COVID. COVID has affected our lives, as we all know, tremendously. I think we've got to a point in time at last where we're beginning to realize that it's a bit like many other viral diseases. I do hope that people listening who are not vaccinated will go and be vaccinated, because it is the answer, like it is to lots of other viral diseases. I mean, nobody used to complain about having a vaccination for smallpox or measles or mumps when they were baby children. And yet they seem to be more anti at the moment about COVID. And we know that it's stopped the death rate. It's not going to stop the disease. It's rather like seasonal influenza. people still get flu, and 1.5 million people every year die from flu. So we're not there bad. Everybody goes on about the number of deaths from COVID. Go back 100 years. Spanish flu killed not 5 million people, 500 million people died from Spanish flu. So I'm hopeful that COVID will be something we'll learn to live with, and it's just going to be a viral disease. You get vaccinated, you're careful, wear social distancing and masks should carry on probably until it's beaten. So yes, fundraising hopefully will come back. In the past, I found a problem with fundraising in that we have a small community, and the same people are being attacked all the time. I say attacked, but being requested to give funds for very, very good causes, whether it's heart and stroke or diabetes or cancer or whatever. So there's a lot of people asking the same people to come forward, and that makes fundraising difficult. The last 2 years, we've dropped our income incredibly to run this place because we've not been able to hold any fundraisers. And social distancing, the breast screening program runs a wonderful breast program walk. We're planning on a prostate cancer day for a walk. And I held it, fortunately, just before COVID, before lockdown, it was in February 2019. I held a big fundraiser to help run the prostate cancer trial, and we raised over 100,000 for that trial. So it is possible, and if you get the right help, then of course we can raise the funds. But it's hard work. Thanks to our volunteers, we do get out there and get funds. But we have a problem at the moment, and the last 2 years have been very barren.
We talk a lot about medicine, but what about the use of complementary medicine or non-traditional means of cancer treatment?
Yeah, that's an interesting question, and I'm not against it in any way at all, complementary medicine. Complementary means in addition to whatever treatment is being done. I'm very anti the use of the term alternative medicine. There are no alternatives. I've seen people who have been my patients and been told about a clinic in Mexico, and they spend all their money and go down there with fad diets and whatever, and it's totally useless and they die, and it's really tragic. So I don't believe in alternative medicine, and I don't think it works, but I do believe in complementary medicine. And the fitter you are, the better our treatments are going to work as well. I'm a surgeon, and certainly people who are fit for surgery are going to do much better than those who are not. So yes, I think there's certain things. I don't believe that if you let's take prostate cancer because that's the commonest here. We've heard that if you take boron or pomegranates or selenium, that will prevent the cancer. There is no evidence at all. But people have stated that it might help. So if it might help, yes, it's not going to do you any harm. But the problem with people who practice alternative and complementary medicine, they refuse to join any trials. I tried when I worked in England for most of my working life, and I tried desperately hard to do some trials with people who run complementary medicine institutions. None of them would agree to enter a trial. So we can't really compare it.
So what about those people who opt not to go through chemotherapy?
Those people who
opt not to do chemotherapy?
It's a good question. I think if you have a cancer, let us take pancreatic cancer, which is probably it's probably the worst cancer to sadly have. We have shown that chemotherapy is only effective in a very small percentage of patients. To actually go through, let's say, your last 4 to 6 months of life actually feeling miserable and horrible, I would say to my patient, it's your choice. Do you want to have an extra 6 months? But if you don't, and you'd rather have you're pretty okay at the moment, I'd rather enjoy that. And I've actually had a great friend who's a benefactor here, whose wife is out of the blue just got pancreatic cancer, and we talked it through. And he said, "What would you do in my wife's position?" And I said, "I'd let her enjoy whatever life is left." I think there are times when you have to make those decisions. But chemotherapy for some cancers, very effective. Hodgkin's lymphoma, testicular cancers are really cured by chemotherapy. What to me is even more interesting is immunotherapy, which is coming on by leaps and bounds. And some of the cancers that have been not affected by chemotherapy are seemingly, like liver cancers, responding to immunotherapy.
What is immunotherapy?
Well, it's using cells of the immune system in your body and others, and it's looking promising. That's all I can say at the moment.
Any final thoughts as we wrap up?
Well, I think we should just mention that World Cancer Day is an important day. We don't hear a lot about it, but in every country in the world, I think now, they are talking about it, and it's making everybody more aware of what they can do. Change their lifestyle, eat sensibly, exercise, and come to and be screened. If you have any suggestion of cancer in the family, if you are middle-aged, I'm going to be careful with how I phrase this now, then yes, come and be screened. There are the common cancers you can be screened for.